Good afternoon, and today I have a pleasure of interviewing very famous doctor and author from Australia. Good afternoon, Dr. McIntosh.
Hello, thank you so much for this opportunity.
And I want to introduce Dr. McIntosh to my audience. He's author of the multiple books. I don't know, I think 7, right? Is that right?
I think it was 7 or 8. I've lost count too.
Yes, me too. But I did my homework on Amazon. I found 7, but I thought maybe I missed one. So 7 book on Amazon, and he's ENT and pediatric ENT, and he's very passionate about the topic. What's so relevant to me and to my audience on this channel. So if you are someone who cannot sleep well or sleep next to snoring partner, this program is definitely going to be for you, because this is exactly the master who knows what snoring is and how to make that better or eliminate that problem. And if you're a medical professional who, just like us, trying to put a little pieces of this dangerous disease called sleep apnea together, this program gonna be for you, because Dr. McIntosh very passionate about this topic and about dental connection, dental medical connection, or nose mouth connection, facial development, evolution, the topics I'm so passionate about, and the topics I illuminate in my upcoming book called Breathless Awakening, and I invite all the audience to participate in my lunch and promote this message to humanity, I would say. So, Dr. McIntosh, usually I introduce my guest with bio, but in your case, I'm going to talk about how I learn about you, not only about generous and kind human being who is so passionate about proper child development, but also it was 2 people who both I interview on my channel. They talk really highly of you and your upcoming lecture or presentation on MU conference, which is going to be in September. So Dan Brunet highly recommend us to connect, and Dr. Mew, who I just interviewed on this channel. And I read your books, and I think that's a wonderful topic. I would like to ask you, what made you, being pediatric ENT, so passionate about connection between dental and ENT, mental and ENT, and I'm talking about your books also, kind of help parents to navigate this area, I would say most often area of concerns.
Yeah. So look, thank you for a very kind invitation again, and that very heartwarming introduction. I appreciate that. So look, my story is a long journey, but I obviously don't want to go into my life story, so I'll give you the simple version. So I started to notice after my ENT training that dentists had an interest in airway, and this was not something that I was familiar with. In fact, I found it quite surprising. But what was more surprising is that they actually had a very good knowledge base about airway, breathing, and sleep. And that led me to explore what they were learning and what they were, being taught. And I saw some excellent things and I saw some problematic things. So that led to me starting to do some teaching and lecturing to share my ENT knowledge. But also I started attending dental and orthodontic lectures and clinics to learn their knowledge, because as a medical person, I'm not trained in dentistry or orthodontics. So, these are not things that I have any knowledge or, expertise in, but I certainly had an interest to understand. And in doing so, I learned a very important life lesson when it comes to pediatric sleep disordered breathing. In my teaching, in my training, it was my learning and then my understanding that when we had the children that had the breathing and the sleep problems, they were snoring, they were mouth breathing, they had sleep apnea, all I had to do as an ENT was take out their tonsils and adenoids and they would be better forever. That is what I learned. That is what I was taught. And it was actually dentists that I started to learn from that was wrong. And then I felt challenged by that. I felt that I couldn't possibly be wrong. I had done all these years in medicine, all these years to be a surgeon, all these years to be a specialist. How could a dentist know more than I do? How could I be wrong? And I was
That's
wrong. And I was wrong. Okay. And that stimulated me to learn more, because if I was wrong about that, what else was I wrong about? What else was it that I didn't know? And my personality is I don't like not knowing. If I come across something now that is new, I don't dismiss it. I learn more about it. If it's different to what I know, I don't dismiss it. I will fact check it. And look, and sometimes in my fact checking, what I have seen, it is not correct. But other times it changes everything. And that's what's happened to me over my career. I've transitioned from being an ENT surgeon that does tonsils and adenoids and fixes everybody to someone that recognizes that tonsils and adenoids are still important. We shouldn't ignore it, but it's not the whole story. We need to look at the jaw structure. We need to look at the nasal function. We need to look at the breathing patterns. We need to look at the myofunctional elements. We need to look at everything if we want to fix everything. And I think part of the reason that the confusion exists is perspectives. If you take my traditional training, my traditional ENT knowledge, and then you come across another ENT that has the same, well, they will have that traditional approach, tonsils and adenoids, and that is it. And I used to be that person. You know, that used to be me. If we were having this conversation in 2008, you would have no reason to have this conversation with me. I would not. I would just be another ENT out there, like the many other ENTs that are out there. But you talk to me now with nearly 20 years of evolution and development and refinement and growth, we have a very different conversation. Even though my initial ENT teaching and training was the same, my ongoing learning has changed that. So where I sit now is I sit in between everything. I recognize the importance of ENT. I recognize the importance of dentistry and orthodontics. I recognize the importance of breathing patterns, myofunctional therapy. So that now when I see a child and I recognize that there are problems with their tonsils and adenoids, I'm also looking for the other problems. I am looking for the jaw growth issues, the narrow, high arch palate. I'm looking for changes on their teeth of teeth grinding, um, early dental caries, associations with allergies and asthma, and then the knock-on effect this has with their breathing relates to their sleep, and then how that then overlaps to their health and well-being from a mental point of view. Because I learnt way back in 2006, there was a very important research paper that showed a very high number of children with sleep apnea being misdiagnosed with ADHD. And then we start seeing other mental health problems, not just ADHD, but ASD. And, that's sort of in the neurodivergence. But when we look at mental health specifically, we start to see things like the depression and the anxiety. And I started to see child after child after child. And, it was just like, this cannot be a coincidence. So then I go and learn some more. And it's not a coincidence, elements of this. So my ultimate reason for what I do is to make myself better in what I know, because the more I know, the more I can help, is how I view myself. But I don't want to keep it to myself. There's no point me knowing this and keeping it to myself, because one day, like all of us, I will be dead and buried. And what is in my brain will no longer exist. So that's what motivated me to start writing, to start sharing my knowledge, and to put it in a way that is translatable. There's no point me writing a book with big words that people don't understand. So I use a lot of analogies. I like to give people explanations of things that is in an analogy rather than dictated as if it was a medical book, because people can understand analogies a lot better than they can understand medical terminology. So I know I said I was going to give you the short version, and trust me, that was the short version.
No, that was great. That really explained where you're coming from. And I like the fact how you mentioned, and I always mention it in my book or in my, in my speaking, what science is not a closed book. Whatever we think was true today, what is true today may not going to be true tomorrow. But I'm going to ask you practical questions because I want my audience to learn from you. So tell me, if you work on intersection between ENT and dentistry, and what's the most common overlook root cause of pediatric sleep disorder breathing, what we both, dentist and ENT, overlook? Obviously, what if this is hanging, we don't overlook. If crooked teeth in front of us, we don't overlook. And, palate, we don't overlook.
Yeah.
But is it anything what we overlook?
Yeah. Look, I think this is actually very easy to answer from my experience. And this is just me, okay? Obviously, everyone has their own stories. I think as a medical person, the thing that I know that I wasn't even overlooking it. I didn't even know how to look for it. Like, it wasn't like I saw it and then ignored it. I didn't even know how to see it. Was the dental and orthodontic elements, the tipping of the teeth, the teeth grinding, the narrow palate, all these things. I just didn't know, and I'm not uneducated. I'm not stupid. I'm just ignorant. I didn't know about it, and because I didn't know about it, I didn't look for it. So and because I didn't look for it, obviously I didn't see it. And as I say, if you don't see, okay, you don't find, and if you don't find, you don't fix. So from a medical point of view, I would say pretty much 99% of anything that is dental is missed by medical people. And that is just a reality of our education. Okay, it's not a criticism, it's not an arrogance, it's not a belittling, it's just a reality. If you to ask a medical person what they know about molar hypomineralization, they would say, I've never heard of it, I don't know what you're talking about. If you were to say, what are the risk factors for early dental caries, they would go, I don't know much more other than probably sugar. And you might be lucky if you even get that out of them. So all these things are things that we are, as medical people, totally unfamiliar with. And as a consequence, we'll completely miss. If I was to look at it from the dental point of view, I would say that my experience is biased in some respects because I work with a huge amount of the dental community, and I have been involved in their education process in the past 20 years, both teaching them and learning from them. So there's been a shared experience. So my answer here is a little bit biased for my own personal thing, because I find now that the dentists are much better at finding airway problems than the medical doctors are. And
That's
again,
such
that's not
a
a criticism.
compliment. That's such a compliment from you.
Well, I'm just being truthful. They really are. And I think it's because of the understanding of the dental signs that you're very well trained to find, that you understand there could be, not necessarily that there is, but there could be an ENT problem in the mix. And because that you are professional, because you are diligent, and because if you're going to start treatments to address the dental problems that could have an underlying relationship to an ENT problem, and by not addressing that ENT problem, your work and your treatments are not going to be as effective, you actually seek out that ENT advice and feedback so that you know what to do. So, for example, if a child needs expansion. Now, if a child needs expansion and they've got huge adenoids or major allergies and they can't breathe through their nose, the expansion is not going to work as well, and it's not going to achieve everything you want to achieve. So this is a scenario where, me coming in and giving the child an airway, and then you coming in and doing the expansion to maintain that airway and make it even better than what I gave them, is a win for that person overall. And, we shouldn't be fighting. I think that's probably the one problem I see still to this day, is people fighting over territory, claiming that they can fix everything. I see medical doctors saying they can fix everything, and I also see dental people saying they can fix everything with their treatment alone. Now, I just know enough to know that that can't be true. Yes, I know. I know that there will be children that I can fix just with tonsil and adenoid surgery, because there are some children like that. And I know there are some children that you can fix with just expansion, because there are some children like that. But that is not most children. So just having these little ones here and there where that's all they need doesn't translate into most children. Most children, probably in the range of 60 to 80%, which is a very high number, they need both of us working together. And
Yeah.
and that's what I've noticed with the dentistry. So the only time I see dentistry overlooking airway is if they have been taught in a certain way that they can fix everything, like I was taught that I could fix everything. So that's a failing of their education. Or they just haven't been taught anything at all. And again, either way, it's a failing of their education. So I think if we can all be open to learning new things and using those new things to change, and that's really important. You have to be open to change. That's how we start getting better for our patients.
I would like to ask you, as a dentist who treat adults, and a lot of adults, they come to me with a nasal obstruction, or they don't call it obstruction, they call it, I'm a little nasal. That's why I adapt myself and I breathe through the mouth. And for me, it's a cascade, like I don't even have to take an x-ray. I already know what's going to be inside. It's such as case after case, and it's so many people. But in what way do chronic ENT condition, like nasal obstruction, enlarged adenoids, you can call it ear infection related to that, influence mental and emotional health in children, and then it become adult? And why is it so often missed? It's not so missed because parents bring children to pediatricians and they get antibiotics, but I don't think it solved the story.
Yeah. So again, a lot of it is education and knowledge, and you look at it and go, well, a pediatrician is an expert in children, okay, but they can't be an expert in everything. I as an ENT, I'm not an expert in everything that is ENT. I don't look after adult cancer ENT anymore. I haven't done it for nearly 20 years. Now, I am trained in it. I have, done the surgeries and everything that is involved, but I have not done that for a long time. So even though I am an ENT head and neck surgeon for managing cancer things, I don't do it simply because it's not something that I have kept up with in my knowledge or skills. So from that point of view, I think the same thing can happen is with a pediatrician. A lot of pediatrician work is ENT, but they don't necessarily get very good ENT teaching or training, and they can't keep up with ENT when they have to keep up with everything else. When I went to university for diabetes medicine was easy. There were only 3 medicines that we had to learn, insulin, metformin, and so forth. Now there's a new diabetes medication every 6 weeks. So to keep up with diabetes is a challenge for the doctors, let alone then asthma, and then all the other conditions that we could mention in healthcare. So what that means is that people can have trouble with their initial education, but then they can have trouble with it being updated in every single field. And this is what can happen. So my observation would be, if you have a child as initially with breathing or sleep problems, then you need to see a specialist in breathing and sleep. And the starting point there is an ENT pediatric that focuses on these problems. And the reason that this is important is that often what I see, and then what you're describing, is people have these problems in childhood and it gets dismissed. And then they come into your clinic and then they can't breathe properly. And they say it's not so bad. So let me explain this to you. They're used to it. Okay. Now, I'm not the best example. You're a more beautiful example. Look at your hair. Okay. Now, I guarantee you, from when we first started this conversation to now, your hair's got longer. Did you notice? Of course not.
I
But I
adapt.
guarantee tomorrow it'll be even longer again. but it won't be until many, many weeks or maybe months that it's so long that you do something about it, okay? Because you took a while before you noticed it. And this is the same with the adults with the breathing. Their nose is blocked for a long time. They get used to it. They get used to it. Now, very, very slowly, for many different complicated reasons, it slowly gets worse. So they go from, oh, it's been okay. I've been a mouth breather for a long time, but I've just noticed recently that my nose is no good. And I have a look and their nose is terrible. Okay. Their nose has been bad for a long time, but they got used to it. It became their normal. Just like you don't notice, for example, if you're right-handed, you don't notice that you're right-handed until you break that hand and you have to try and do things with your other hand for a while, and you realize just how terrible you are and how reliant you are and how you take it for granted. And that's what people do. They take their breathing for granted. They don't recognize that they have a problem until things get worse. And the problem is that when things get worse, we've missed the boat, because we know in adults having a blocked nose, from childhood is associated with poor jaw growth and development. Having a blocked nose and poor jaw growth and development is a risk factor for sleep apnea as an adult. They start to put some weight on. They start to get sedentary. For women, they might go through menopause, for example, and these can all be the tipping points for why things that they felt were not an issue start to become problems. And I think for me, I say this, jokingly.
I would like to ask you, often say what crooked teeth, it's not a dental problem, but a symptom of something deeper. So can you walk us through the hidden chain reaction, what begins in the airway, but ends in the mouth?
Yeah.
Because
Look,
some
I think
people say it's genetic.
Yeah. Look, I think it's important to think about this as basically being a circle that we're going to go around in. Okay. Now, genetics is involved. I don't want to dismiss genetics. Okay. But many disease processes is genetics and environment. And your genetics can predispose you to a problem. They can also protect you from a problem. Okay. So, people, not that we would recommend it, but some people have amazing genetics, which means they can smoke cigarettes from the age of 6 to 100 with no problem. Now, that person got lucky when it came to genetics. They still made a bad life choice in terms of smoking, but it just so happened for that person, they had great genetics, which meant that their body had resistance to the effects of cigarette smoking. Okay, but we can't use that as a reason for things to be okay. So, and then likewise, people can get the lung cancer and they never touch a cigarette in their life. Okay. So genetics definitely play a role in terms of predisposing and protecting, but then, it comes down to those environmental things. And when we look at it, breathing is the big one. Okay. And when we look at breathing problems, if we look at it in the general population of children, it's roughly about 20% of children in the general population. But if we look at the population of children with crooked teeth, it's 60 to 80% of children. So there is a disconnection there. There's a much higher rate of breathing problems in children with crooked teeth. And we know this from the research. And like I said, we sort of go around in a circle. And it doesn't matter where the circle starts. The problem is when you form the circle, it keeps going. So we have something. So we have some reason the child stops to breathe through their mouth. So it could be allergies, the adenoids get big, for example. As a consequence of the mouth being open, the tongue is low, and the muscles on the side walls of the cheeks hold things inwards. So there's a compression force inwards and there's a lack of expansion force upwards. So the result of that is that the upper jaw grows narrow. And the problem with that is it doesn't just grow narrow from side to side, but it also restricts its growth from coming forwards as well. So the jaw is narrow and backwards. The effect of that is to reduce the space inside the nasal passages and the space behind the nose. The consequence of that is it perpetuates mouth breathing, which then perpetuates the lack of growth. And then when we fast forward and we see these people in adulthood, to me, that was a failure. That was a failure of medicine and dentistry combined. It was a failure to identify this growth problem, a failure to identify this breathing problem, And now this person has got some serious things that need to be fixed in rather significant ways because we missed it in childhood. So I think when you look at the crooked teeth, yes, I will accept some of it is genetic. I will not argue, because there's no point having the argument. But a lot of it has environmental factors. And the way that I look at it is that we are having these arguments we don't need to have. We don't need to argue whether the breathing causes the crooked teeth or not. Because if a child turns up with a breathing problem and crooked teeth, do they have two problems? Yes, they have two problems. Do they need two solutions? Yes, they need two solutions. Does it matter if one caused the other? No, you've still got two problems. So we see all these people going into these really academic arguments over whether the child has this problem because of the breathing problem, and then saying it's not because of the breathing problem, and then using that as a reason to ignore the breathing problem. It doesn't make sense. The child has two problems. As to why they developed those two problems, all of a sudden became irrelevant to the fact that you have two problems to fix.
Thank you very much. We really appreciate. And to my audience, please find Dr. David McIntosh books. You can find them on Amazon and learn about connection between dental and ENT, dental and ENT, and a guide for parents how to approach ENT health for children. Really, easy to read, fun book to educate yourself. But most important, Dr. McIntosh going to do the presentation on the MU Symposium in September, and you can get the tickets underneath this. You can get the link to the tickets underneath this interview, and please follow our channel to find out more about Dr. McIntosh books and his work. So thank you very much, Doctor.
Oh, no, thank you. It's been fabulous. Thank you again.